Good morning, everyone. I would like to find out, first of all, if you can hear me. If you can hear me, please type on the chat box that you can hear me loud and clear coming to you from Nairobi CBD. Thank you very much. Great. It's so nice to see everyone or feel that you are here with us. And welcome to the last day of the conference. Under normal circumstances, we'd be looking out at the sea, at the beach, and looking forward to having a night where we all get drunk. But today, it's back to work, like we've been for the last 7 months. And we are hoping that we can enjoy this virtual conference in the same spirit that we enjoy the real conference. My name is Aneez Rahemtulla, and I'm the member of the National Executive Committee. Later on in this presentation, we'll tell you what that really means. And we look forward to having an interactive day and not just you switching off your video and your audio and then going to do other things. So we're going to start with a little exercise, and it's not a physical exercise, but it's something that I need you to get involved with in your chat box. So if you are if your registration number, if you're a pharmacist, let's start with that. If you're a pharmacist and your registration number is greater than 5,000, put your number on the chat box. Is there anyone over 5,000, or we have not reached 5,000 yet? Oh, there we go. Anybody else over 5,000? So I'm not sure if that person is the youngest or if that person is the last to register. But we have a 5102. Anybody 5,000? Okay, let's go down. Anybody over 4,500? The Watotos. Anyone over 4,500? Okay, maybe not. Anyone over 4,000? Oh, okay, there we go. We are at 38, 32. So there wouldn't be anybody over 4,000. Okay, there we go. Anyone over 3,700? 3,700 and above? Okay, maybe not. Oh, there we go. All the Watotos are joining in. Karibuni. All right. 3,500 and above. Okay, let's go a bit faster. 3,000 and above. Just know if your number is not on that, you're not getting CPD points. So better get your act together and put your numbers in. Over 3,000. That's better. See, CPD points always works. When you say CPD points, everybody is attention. Even if you're on mute or you're in a remote location, it beeps on your phone. Kuja weka number. Okay, 814, we're not there yet. Anybody else over 3,000? 3,000 meaning 3,001 and above. Okay, let's go. 2,500. These are the not so young. Okay, great. 2,000 and above, there should be more of you. Those of you you still know how to use the internet much better than all of us. Great. 2,000 and above. Those are too few.
Now.
Okay, great. Now we are going to the little bit older ones. 1800 and above. Excellent. Okay, now we are going to the level where you'll need somebody to put to put your number for you, because you probably don't know how to find it. Say 1600 and above. Okay, if you found somebody to put in your number over 1600, please put in your number 1600 and above. Excellent. Okay, now we're going to the wazee wa kazi. Over 1500. 1500 and over. Oh, those are not wazees. They are still young, those boys and ladies. Okay, let's go to those from the great 90s. Okay, 1300 and above. Okay, 1000 and above. Okay, now we're going to stand up. Where you are, stand up and clap for these people who are in this section, who have managed to stay here all this time, below 1000. These people who are below 1000, stand up and clap for them, because they have managed to remain pharmacists for a very, very long time. Okay, do we have anybody below 654? Anyone below 654? Great, I think we have a winner. Congratulations to 654 is Philip Nandi, the oldest pharmacist present and able to type the number. Well done. Good job, everyone. Thank you very much. You may sit down if you're still standing. Hey, there's a 594. Excellent. 594. Okay, so the 600 has been beaten. 594. Well done. 594. I didn't see the name. If you're 594, please put your name so I see it on the chat. Dr. Habil Onyango, 594. Well done. Congratulations. Congratulations. Great. Good. Now we're ready to start the conference. I want to hand over to Dr. Sylvia Vito, the Africa head for acceleration, PMO Astrazeneca. Now we are going to have a lot of acronyms in this all through. You'll hear PSK, PPB, PMO, PPD, CPD, ABD, ABC, all those things. So when you see something PMO, just to help everyone, put on the chat what you think PMO is. So Dr. Sylvia Vito, she's going to be talking about another acronym, Africa PUMUA initiative, reframing asthma care in Africa. Welcome, Dr. Sylvia.
Thank you very much. Can you hear me loud and clear?
Yes, I can.
Fantastic, and thanks for the very exciting introduction. Let me start by observing all protocols. Mr. President, Pharmaceutical Society of Kenya, Dr. Louis Meshagu, our PSK 40th Annual Conference Convener, Dr. Eva Amwai, senior colleagues, as we heard from our registration numbers, fellow pharmacists, ladies and gentlemen, all due protocols observed, I greet you this morning. It is indeed a very humbling opportunity for me to be able to share and participate in this first ever virtual Pharmaceutical Society of Kenya annual conference, which, as very well stated by Dr. Eva Amwai, it marks the beginning of a totally new era for all of us as humanity, and of course for us as pharmacists. Even more so, I think in the new dispensation, our role as pharmacists has become a much more critical role. We are much more critical stakeholders in delivery of primary healthcare, as would have been emphasized by our PSK president, Dr. Mashogu. In his address, he was very clear in iterating that the patient journey has shifted significantly now in the COVID era, and the pharmacist is now playing a very essential focal role when it comes to patient care. Okay, so I'm here today from Astrazeneca, and my role actually stands for, I lead the Africa business, that is South Africa, Sub-Saharan Africa, and French-speaking Africa, looking at our investment initiative 3 years, 5 years, 10 years outwards. So any project management that we do inspires investing in healthcare, investing in capacity building, in science, in portfolio, in channels. That is what my role particularly does. So no great rewards for the PMO acronym, but maybe Pumua in itself actually stands for Pumua, the word, yeah? So Pumua is not an acronym, just to make sure that we are all clear. Pumua is the word in Swahili, and I'm going to be sharing a couple of my slides. Please let me know if you can see my slides clearly from your side. Can we see my slides? I'll rely on a colleague just to tell me tuko pamoja.
Yes, you're okay.
We can see your slide.
I need a lot of assurance. All right, thank you very much.
We can see your slide.
All right, fantastic.
Want to see those drugs.
So as we mentioned earlier, from Astrazeneca, as you very well will be knowing that Astrazeneca is one of our leading biopharmaceutical companies that focuses on a lot of science, driving a lot of science, whether it is that in the respiratory space, oncology, cardiometabolic diseases, specialty care, and of course, primary care. In my focus of discussion today, dear pharmacists, I'm going to be looking at what we as AstraZeneca are doing today in Africa, specifically narrowing it down on respiratory diseases. We do a lot on diabetes, on hypertension, prostate cancer, breast cancer, to mention but a few, including, of course, non-small cell lung cancers as well. But I'm going to narrow our discussion in terms of the initiatives that we are leading and championing in Africa when it comes to respiratory diseases, hence the word Pumua. So the Pumua that you're seeing is the Pumua itself, breathe, okay? So as a company, of course, we have evolved, and I just wanted to impress upon you to walk with me on a journey where I would like to bring to your attention, fellow pharmacists, that our participation in healthcare sector goes beyond bringing you great innovative medicines. We consider ourselves to be a platform organization that looks to work with the other stakeholders to close the gaps that exist in the patient journey. These would be gaps that need partnership in technology, partnerships with devices, organizations, partnerships from a policy level, advocacy, training, engagement, in addition to the medicines that we bring to you. So that is a journey that I want you to wear a lens when you listen to the slides to my presentation today, to look at AstraZeneca, not just the company that brings you great medication and great science, but that we are offering you a lot more. And here is just to iterate our commitment to, number one, access to healthcare. We do consider ourselves that in everything that we do as a company, the patient is at the center of every decision that we make. So focusing on, let's say, respiratory medicine, there are a lot of gaps that exist today in the African continent where patients are unable to access quality care, either due to low levels of awareness. Let's talk about asthma as an example. Very huge gaps when it comes to asthma awareness, very huge gaps when it comes to the stigma associated with asthma. We know that there are over 40 million asthmatic patients in Africa today. 30% of them do not seek care. And in typical health-seeking behavior, these 30% either resort to prayer. Granted, it's important. They resort to herbal medicine. There is a place for that. They resort just to staying at home, and the only time that they come to the forefront is when there's an acute asthmatic attack. And I'm talking about your typical African patient, not the one who has medical insurance that most of us probably would be having. Your typical African patient is reliant on the public sector when it comes to provision of health. So in my conversation today, when we talk about the Africa patient, let's open our minds and talk about our typical African patient. So we see ourselves as an organization that is here to drive access to healthcare. This is from a perspective of driving awareness of diseases like asthma, supporting all healthcare infrastructural setups to remove the stigma on asthma and respiratory diseases. We are here to support the capacity gaps that exist within our system, because what we've realized that over a couple of years, when you talk about the healthcare provider on diseases like asthma, the nearest person to those patients is most likely going to be a community health worker, is most likely to be a pharmacist, is most likely to be a GP, and not usually a specialist in asthma management. But when it comes to cascading the knowledge, the treatment guidelines and protocols, we always stick to the specialist level. We feel that there is a gap that exists where we need to bring, and let me narrow down on the pharmacists, to have very good education initiative continuously and consistently that upgrade us and update us on the GINA treatment guidelines as an example, where we proactively come in and support education of community pharmacists, hospital pharmacists, or the pharmacists who are closest to the patient for that matter. The other gap that does exist, of course, is when it comes to updating of treatment guidelines. Yeah, so we find that our local guidelines, and we've had this conversation with the Respiratory Society of Kenya, but we also feel that this conversation needs to be held also with the Pharmaceutical Society of Kenya, with the Association of Pharmacists, so to speak, because this is the umbrella body that encourages and ensures that capacity building of pharmacists is happening. So where are the GINA guidelines today as far as asthma care is concerned, and where are our pharmacists? There might be a gap. And only we can work together to close this gap to ensure that we as an organization named Astrazeneca, we are supporting our Society of Pharmacists to ensure that we give you all that you require to have continuous education when it comes to international guidelines of care for asthma, diagnostic capabilities of asthma, because half the time we think the diagnosis of asthma can only happen in a hospital setup. But I'd like to impress upon you, ladies and gentlemen and fellow pharmacists, that when you look at what is happening across the rest of Africa, the pharmacy is a focal point of care for majority of the patients. Countries like Ghana, community pharmacies are actually the focal point when it comes to asthma diagnosis, because in such setups, we are able to empower our community pharmacy to have all the primary prerequisites as far as diagnosing asthma is concerned, and they can refer these patients now to their GPs or to a hospital setup. But I think the picture in Kenya, there is still quite a distance that we need to make sure that our pharmacies are not just a point of dispensing medicine and advising our patients, but they're a point of care where you could have either a doctor virtually available in the pharmacy, okay, to the patient, or sometimes even a nurse or an AMO available, in addition to making sure that the pharmacist has been given all the tools that they require to be able to support the patients who come to them. We do a lot of work, of course, on environmental protection, and here I'm also narrowing down the conversation to lung diseases, and we've done quite amazing sustainability initiatives in Kenya at Dunga Beach when it comes to lung health, and ensuring that we are supporting prevention of lung diseases that are associated with lifestyles, okay? Whether it's a type of fuel that our people tend to use as part of their livelihood. We also believe in running a very transparent and ethical business, and we do this because inclusion is important to us. Carrying with us all our relevant partners is critical in a very ethical and transparent manner. So this forms a part and parcel of the sustainability initiatives that we look at in everything that we do. What I'd want to do before I play the next slide is just to let you know the journey that I've been leading the organization on when it came to asthma care. We did quite a diverse baseline setup when we looked at asthma management to find out why is it that these 30% of the 40 million asthmatic patients do not seek care. We know that the typical health-seeking behavior of a patient today, if they had any illness or were feeling cold or something, is that they will go to a pharmacy. But we did realize that as a company, we've probably not invested enough in supporting our pharmacists and our pharmacists to be well equipped to manage these patients when they do show up. So that is number one, that Africa Pumua initiative, which I'm sharing with you today, is looking to addressing the gaps and areas where we as AstraZeneca are going to come in and partner with you as pharmacists when it comes to driving awareness of asthma, closing the stigma associated with asthma, driving capacity building of the healthcare provider, of which central to that is the pharmacist. So making sure that the treatment guidelines and protocols have been cascaded and shared with pharmacists at every different level where they find themselves, so that when patients come to you, they find you well equipped and updated. You definitely understand how to manage asthma, but what we are saying is, can we ensure that we are proactive in engaging you continuously through the Respiratory Society of Kenya, so that RISOC as an organization, another acronym, also is partnering with PSK, and AstraZeneca is willing to bridge that gap. We're doing amazing partnerships with government when it comes to ensuring that we're going to bring in quality care, capacity building of all healthcare stakeholders in public and private sector, in addition to access to quality medicines from AstraZeneca in both public and private sector. We're going to be doing this to ensure there's equitable pricing as well, which is something which is at the center of a lot of the concerns that a lot of people would have. We are focusing on real-world evidence data generation, because Kenya as a country right now, our level of data when it comes to asthma management is not as much as we'd want it to. Many companies have done great work on generating data, and we have put ourselves out there to ensure that we continue supporting data generation. So as a pharmacist, you need to ask yourself, what will be my role in supporting data generation in asthma management? This should not just be left to the prerequisite of the prescribers. We as pharmacists will step into that space, and if it means supporting data from the community pharmacy level, from the hospital pharmacy level, we are seeking you out to work with us through RISOC as well, so that PSK and RISOC can be a partner in ensuring the Kenyan patient today is well taken care of from a data perspective. So I want to play just a short video. Okay, I'm just going to play a short video just to take us on a journey of what AstraZeneca is about when it comes to the Africa Pumua initiative.
Africa is said to take your breath away. The beauty, the splendor, the vastness, the sunsets and the sunrises. To many in Africa, it's not the beauty that takes their breath away. Pumua, to breathe. Pumua, the initiative. In Swahili, the word for breathe is Pumua. Life is measured in breaths. From the first breath we take to our last. And quality of life is all the breaths in between. AstraZeneca is improving quality of life day by day, patient by patient. The AstraZeneca Africa Pumua Initiative is an innovative program committed to redefining asthma care in Africa. Why Africa? The statistics are simply breathtaking. The disease is real and affecting more and more people daily. There are more than 40 million people living with asthma in Africa, and every single breath they take counts. Asthma patients don't need to hold their breath any longer. As building on a 50-year heritage in respiratory care and their portfolio of medication to treat asthma, AstraZeneca's ambition is to redefine asthma care in Africa by supporting fundamental changes in the management of asthma. Through public and private partnerships, this initiative will strengthen local health systems and centers. Supported by invaluable local knowledge and expertise, the aim is to build an infrastructure for asthma patients with nebulization machines, nebulization stations, spirometers, and peak flow meter donations. By supporting healthcare worker capacity building across the pediatric and adult asthma patient journey, we aim to ensure effective diagnosis and enhanced referral systems. Facilitating equitable access to high-quality Astrazeneca respiratory medicines in the public and private sector is aligned with AstraZeneca's sustainability goals. Through AstraZeneca's partnership with various governments, healthcare professionals, and society, the African Pumua initiative aims to improve pediatric and adult asthma management across public and private sectors. We aim to positively shape treatment guidelines and protocols for chronic asthma aligned to the GINA guidelines. This initiative forms part of AstraZeneca's sustainability commitment to deliver improved accessibility, acceptability, affordability, and availability of quality care in Africa. At AstraZeneca, we are unwavering in our commitment to improve care for asthma patients throughout Africa. People living with asthma deserve the best care and to be able to live normal and healthy lives. Inhale for a better future, breathe for better life, and make every breath count. Just breathe, Africa.
Yes, we are asking you to walk on a journey with us in the Africa Pumua initiative that we've actually launched this October. It is yet to go live in the public space, but we decided to start it with our pharmacists, given that you are very focal when it comes to patient care. As you would have observed in that particular video, my hope is that you will ask yourself, what will be your role as a pharmacist in ensuring that we can step up the quality of asthma care in the African continent and of course in Kenya? What we are looking to delivering through this particular initiative is to look at 4 key pillars. Number 1, we are committed as an organization to strengthen the local healthcare systems. And this is from a perspective of, as I mentioned, awareness and education, capacity building, of course. But when you look at the infrastructure of asthma management, a lot of our public and even some of our private facilities do not have adequate tools when it comes to diagnosis and support of continuous care of asthma, whether it's nebulization machines that we are going to be donating, spirometers that we're going to be donating, peak flow meters that we're going to be donating. We are hoping that through supporting with these infrastructure items, more patients will be able to approach you as a healthcare provider and find you ready and well equipped to manage them better. And as a pharmacist, that you'll be able to run just very quick testing levels of diagnostic check-ins and refer them to their nearest facility where hopefully through our initiative as well, working with GPs and MOs in the hospital, they'll find doctors, nurses, and MOs that are ready for them as well. That is number 1. There will also be not donation per se, but creation and building of what we call nebulization stations and neb rooms. And not to say that this is just nebulizing, because when it comes to acute asthma care, we just don't nebulize alone. There's also a room for us to use spaces as well. So those are just some of the facilities and infrastructure items that we'll be able to deliver and donate when it comes to asthma. My question on this particular point, as a pharmacist, whether you're in a hospital setup or community, what are you doing to make sure that we can partner with you? We've done a lot of partnership across 4 other countries in Africa where community pharmacies that have stepped up the level of pharmacy infrastructure they have can be able to have either nebulization happening in their pharmacy or even just have a spirometer in there or have big flow meters available for you to be able to add value to the patients who come to your pharmacy. Healthcare worker capacity building, I think I over-iterated that particular point. We think that the pharmacist is also very critical, as I mentioned, in increasing awareness and education. When that patient comes to you with continuous wheezing and everything else, what do you tell this particular patient if you're a community pharmacist? What can we do with you through PSK and RISOC to ensure that we can give you modules and digitized education platforms where you can educate your farm techs in your pharmacy or any other pharmacy assistants that you have to be able to serve the patients better. And of course, last but not least is that we're going to be rolling out an equitable pricing structure for AstraZeneca respiratory medicines in both public and private sector. I feel important to buttress this particular point because private sector has really been at the forefront of investing a lot more in healthcare, but when it comes to our price reductions, more often than not in private, we tend to offer better pricing for the public sector. Astrazeneca is approaching this a bit differently, that the new access prices that we'll be offering in Kenya will be equitable and available both in public and private sector, so that patients don't have to look for a public facility to get good quality medicine that is more affordable. They'll find that same price whether in a private hospital, private pharmacy, or a public pharmacy. That is the journey that we're taking us on. So I think this has already been iterated very well in the video. More than 40 million patients are living with asthma in Kenya today through the Respiratory Society of Kenya as an acronym. We've got estimated about 4 million patients who are living with asthma. And I'll tell you, ladies and gentlemen, out of these 4 million, majority, we've got almost over 60–70% on short-acting beta agonists for their reliever medications, but more than 70% of them remain heavily uncontrolled and therefore advance to severe asthma, okay? So I try to wind up is just to call upon you to think through wider and say, what can we do together with AstraZeneca in support of Africa Pumua initiative so that we can work together and drive a partnership through PSK, through some of you as community pharmacists, some of you as hospital pharmacists, some of you who are in regulatory matters, some of you who are also in policy shaping, and a lot of you also in the clinical practice in terms of data generation. We are looking to that partnership where you can come to the table and be a part of the new future of the patient journey. This is your typical patient journey. A lot of gaps exist, as I mentioned. What can you do? Walk away asking yourself, what will be my role in supporting the Africa Pumua initiative in educating and creating better awareness? A lot of the information usually is in English. Maybe we need to translate a lot of these basic information around asthma into the different languages. And maybe some of us, because you're a healthcare provider, you can come in and be a part of that. When it comes to screening, when it comes to diagnosis, treatment, and monitoring, you as a pharmacist are very integral in that particular entire journey. So I think without really much further ado, for me was just to share at a very much higher level what Africa Pumua initiative is. It's happening in Kenya, it's happening in Ethiopia, in Ghana, in the rest of the East Africa markets, in Ivory Coast, in Cameroon, in Senegal, and of course in South Africa and the other southern markets. It's a big initiative that we are hoping is going to really shift how asthma is managed. Don't forget, we are looking at stepping up on awareness and education, capacity building, guidelines being cascaded, and more importantly, being digitized so that at a click of a button on your phone, you can access the GINA guidelines, you can access the treatment guidelines for Kenya for asthma. Then, of course, ensuring that you've got great diagnostic facilities in hospitals and, of course, in some community pharmacies where possible, and as long as it's in line with the regulatory framework in Kenya. Then beyond that, making sure that we're bringing to you equitable pricing in both public and private sector. And beyond that, wellness, because there's a life after asthma for the African patient. Thank you very much. I want to give it back to the chair of the meeting. It has been an absolute pleasure being a part of this, and I'm hoping that this is just a tester into how much more we can do as pharmacists, because we are critical and we're the center of patient care.
Thank you very much, Dr. Sylvia. Very inspiring presentation. Almost left me breathless. So if breathe is Pumua, what is breathless in Kiswahili? Pumua-less, not very romantic, I say. Great, so if anyone has any questions, please put them in the Q&A tab, and Sylvia will take them on from there. We go on to our next presenter. I was just concerned a bit about how people manage time. So it seems that we are in self-regulation nowadays, and you'll need to regulate your time as a self. But if you don't, then let's just put the problem on the secretary. They'll just cut off your link. Great. Our next presentation is by Mrs. Jocelyn Chaibva. I'm sorry if I mispronounced your name, but you can repronounce your name for our help. It's the Vice President, African Pharmaceutical Forum, and it's the keynote address. She's going to talk about primary healthcare, transforming global health, What role can pharmacists play? Over to you, Mrs. Jocelyn.
Mute. Okay. Hello, good morning. Can you hear
Morning.
me?
Yes, we
Yes.
can.
Okay. My name is Jocelyn Chaibva. I'm a pharmacist from Zimbabwe and currently the Retail Pharmacists Association chairperson here in Zim, and also the vice chairperson or vice president of the African Pharmaceutical Forum. Let me switch on to my video. Uh-oh. Right, my talk this morning, it's more of a motivational talk about pharmacists, pharmacy delivering primary health care, responding to the emerging dynamics. When I look at this topic, Mr. President and your team, I'm actually thinking we don't want to be like dodos. We want to be there whenever as we go along in pharmacy. So to start my presentation, I would actually say it's a keynote address at the Pharmaceutical Society of Kenya. What role can the pharmacist in Kenya play in transforming global health under the primary health care concept? That's the way I look at the presentation. Mr. President, distinguished colleagues, ladies and gentlemen, it's my greatest pleasure to be able to give a keynote address at this year's PSK Annual Scientific Symposium 2020. The year 2020 has been full of surprises, which have changed the way of doing business. When COVID-19 was declared as a global pandemic at the beginning of this year, it felt like we were all going to die, especially with the reports coming from China, Europe, America. This also created panic since it was now a global emergency as declared by WHO. Nurses and doctors were the primary professions to be recognized as essential services. Until the reality of the problem dawned on all, including politicians and governments, there was a call for pharmacists to come and save the world. Pharmacists come and save the world. And how were we supposed to do it? One, by making new drugs available to fight the pandemic. And you can see what was actually going on in research area. And also to come up with a vaccine to prevent it from spreading. And you can see what is actually going around in the world. So many products are on the market, a lot of clinical trials to try and come up with a vaccine against this COVID-19. And then pharmacies were also available and accessible in that time of the lockdown. In countries where there was a lockdown, they actually put themselves at risk by being available to patients, be it in the public institutions or even in community pharmacies. They didn't lock the pharmacies and run away. Pharmacists were there to save the customer, to save the patients. So I'm happy to say pharmacy did not die because of COVID, but has actually lived to tell the story by adapting to the new world order. I would like to say my role today is to address colleagues, to inspire them, to challenge them, and to raise the lead on issues, which is not always an easy task, bearing in mind the fact that whatever one says may be recorded and used in evidence against him or her. Furthermore, in the current media environment, we of the BBC, we usually call ourselves born before computers, that generation, we have always been mindful of our words. So once again, thanks, Asante Sana, for the privilege. As Mahatma Gandhi once said, 3 things always stand forever: the sun, the moon, the truth. So the truth must be spoken and the truth must be won. And when I say pharmacy will not die, but will live to talk about this noble profession. My presentation is in the form of a question. The question is, what role can you as an individual pharmacist? Okay, you can keep that one on that one there. It's a, what role can you as an individual pharmacist who is a primary healthcare practitioner play in the transformation of global health? The next question is, what kind of pharmacist do we want to be? Or alternatively, what kind of pharmacist does the world expect you to be? So to start the ball rolling, I've got a slide there on the screen where we've got a public health setting. Where is the pharmacist? Where are you? At tertiary level, which is usually the referral or higher levels, we've got the specialist services there. And from the presentations I've attended during your conference and symposium, I've seen that a lot of pharmacists are involved in these specialist services. There was someone who was talking about anticoagulant therapy. And then someone was talking about pharmacovigilance in a hospital setting, and so on. At these referral hospitals and teaching hospitals. And then at secondary level, you also have pharmacists. In general hospitals, you have the pharmacist, and the community pharmacist is also there with secondary level where they dispense prescriptions from private doctors or in some instances for products which are not available from the hospitals. Then we've got the primary level, the rural health centers. Is there a pharmacist? Where I come from, there's usually no pharmacist at those low levels. That is the rural health center. Usually it's the nurse, and hardly there's a doctor there. And in some instances, it's at the lowest level of the nurses who will be there at the rural health center. But in terms of support, the pharmacist has got a role to play. They usually go down there and supervise how medicines are being distributed, stored, and everything. And then from the private sector, you have the community pharmacist, who is the primary level and primary access to our patients. And when we talk about pharmacists, this is where the question comes in. What kind of pharmacist do we want to be? Or what kind of pharmacist does the world expect you to be, you and me as pharmacists? So to start the ball rolling, we and only we pharmacists have been given the near monopoly to supply medicines. And I'm sure in Kenya and most other countries in Africa and around the globe, the word pharmacist or pharmacy or chemist or pharmaceutical chemist are protected by law. And only those duly approved by the country can call themselves pharmacists or their premises a pharmacy. Yet our numbers are low and we're available in only areas and regions where business is brisk and bright. I'm talking about the community pharmacist here. Risks are low and profit is certain. So when I look at my slide, I'm talking about the raw level. So as community pharmacists, we're usually accessible in urban areas and so on. It might be because the business is not viable, but I think we have to find a way of getting ourselves down to the rural areas and other poorly accessible places. Someone was saying, if you look at products like Coca-Cola, you find it even at the remotest areas, but we don't find medicines or essential medicines there. And I can't even talk about community pharmacies in those areas. Anyway, can I have the next slide, please? All right, so the pharmacist has got various roles. And from an FIP perspective, we have been talking about workforce development goals. I hope someone got the abbreviation correct and they might get a prize. Anyway, WDG stands for World Workforce Development Goals. And these are originating from FIP, which is the Federation, International Pharmacy Federation. So when we look at pharmacy workforce, we want one who is well educated, they've got the science, and they do the practice properly. So these three areas, they are intertwined. in workforce development. So we look at the various players in this area in workforce development. We've got academia, which is the education, pharmacy education, so that they give the correct education for the pharmacists so that they are empowered to do what is expected of them, or what the world expects of us, or what we expect ourselves to be able to do. And then these pharmacists, they'll be working in various areas, such as manufacturing. There's a lot of research and development. In manufacturing, we're talking of packaging. Those are practice areas. There's education there when we talk about research and development. Then we've got regulatory and policy makers who talk about the quality, safety, efficacy, and we also have to deal with advocacy. I was actually impressed to hear that we have got pharmacists who are members of parliament in Kenya. In Zimbabwe, we've got 3 pharmacists in our parliament who are members of parliament, and we hope they might also have a chance to become even ministers of health, because they have got the quality to do the policies, and they also have got the pharmacy mind and the profession in their hearts. So the pharmacist is also involved in distribution, which is procurement and supply. PSCM, procurement and supply chain management. I heard someone did a presentation on that. People have been talking about this to ensure that the commodity which we make or which we are empowered to look after is will get to the recipients and the users in its good quality, and it will be safe and it will be used. So I can see there someone is, Dr. Eva, yes, I agree, we should have more pharmacists in parliament or in government, because some of the decisions are made in our absence. We are often not found when policies are being made. So let's be there in regulation and in policy making. Then in the pharmacy setting, here I'm talking about the community pharmacy and the hospital pharmacy. So you find that in the hospital pharmacy, we usually, in some countries, we're unable to address the clinical aspects of being in a hospital pharmacy. Community pharmacies, we usually end up just not doing the clinical pharmacy either. We just want to sell the product and just make it back, a quick buck. I do pray that we all work, do our part in promoting the role of the pharmacist. So from FIP, what happened to the 7-star pharmacist that each pharmacist is supposed to be? Next slide, please. In 1997, the background to this document, the FIP policy document of a 7-star pharmacist. The 7-star pharmacist is a caregiver, decision maker, like the policy maker as well in parliament, and maybe ministers of health. I think in Nigeria, we had one pharmacist who was a minister in government. Pharmacist must be a communicator, a leader, a manager, a lifelong learner, and a teacher. So the 7-star pharmacist. So in 1997, at FIP, they released the final paper, which should be considered essential, minimum, and common expectations of pharmacists by healthcare systems worldwide. So it's the patients and ourselves. I think we can even add more stars based on the presentations I've been listening to during your conference. I think there are even more stars than not just 7. Other attributes or stars can be added to the list, including some from the presentations during this conference. So FIP has been running with the theme of primary health care as essential in achieving universal health coverage in line with sustainable development goals. So we have got workforce development goals to support this. It has been realized that without pharmacists, universal coverage is a mirage. So as affiliates of FIP, we must take this message seriously, down to every pharmacist, whether they are members or not. Primary healthcare is the way to go. Now, fellow pharmacists, how well are we trained to carry out these functions? This usually depends on the kind of training we've had during our undergraduate training, and then the support we get from our pharmaceutical associations, like the KPS, is that so? PSK, Pharmaceutical Society of Kenya. They support continuous professional development to make sure that we are never left behind. I always tell the story of HIV. When I was in college doing my degree, there was no HIV. But over the years, when HIV came, I had to learn. And thank you to the pharmaceutical associations who have made me understand this through continuous professional development and continuing education. So as pharmacists, we formulate tablets, pills, cachets, potions, and all those different dosage forms. Yet, with these simple dosage forms, there lies a profound opportunity to improve health and the well-being of society. I want to throw in a few questions about what kind of counseling we would give. So, when a young lady who has just purchased clotrimers or pessaries from us, what do we tell them? Do we just tell them to use as directed, or take one daily, or we tell them to insert in the correct place? Or another example, how do you advise a young man to take a cycle of tablets when the instruction says take one tablet 5 times a day for 5 days? How does he divide the five doses over 24 hours? And what does he do with the remainder or the fraction? So we have to advise our patients to take them properly so that they take them five times a day. And what is critical about them taking that dose that much? Of course, it's not easy to take medication for 5 days, for five times a day. Adherence becomes an issue. Will we know how expeditiously to procure safe fluorescent condoms for a man whose legitimacy? How would you tell this guy who wants some fluorescent condoms for his amorous activities, because they are sometimes frustrated by the need to turn on the light to look for this essential health commodity? We tell them to use condoms, but sometimes we don't tell them how to do it best, and even how to use the condom. Well, in dealing with other health professionals, that's another area. That was the patient. Now with the other health professionals, do we make them aware that there's a big difference between a simple tablet, an enteric-coated tablet, a sustained release tablet, which they should not break in half, an immediate release tablet, or an effervescent tablet, or a chewable tablet? And why are these different tablets available? Adherence and bioavailability become the game of the day. And then another question would be, what advice would you give to a poor raw mother whose son is on insulin but does not have a fridge? How is she going to store that insulin to keep it cool? How many of us counsel patients on use of the meter dose inhalers, patches, lancets, syringes, and how do they dispose of them? Dispose of unwanted medicines. The previous speaker was talking about asthma management. Some patients, they don't get well, not because they don't have the medicine, but because they don't know how to use that pump, the asthma pump. For those who watch who used to watch a certain program on TV with Dr. House, a patient could not get well on their asthma pump because they were spraying it like a deal in the underarms. 7-star pharmacist. Of course, someone is asking about the fluorescent condoms because they don't have to. They don't have to switch on the light to look for this product, which is an essential health commodity. My dear friends, distinguished colleagues, ladies and gentlemen, the list I've given is just a few viable examples or actions that pharmacists could take to change society and transform lives at primary health level. We can empower every single client who passes through our portals by giving them best advice and patient education. In September 2007, the then president of FIP, Professor Kamal Midar, stated that at the FIP conference in Beijing that the model for pharmacy should not be just about supplying medicines. Rather, it should be a patient-focused, medicine-centered care. So, when a patient has been seen by a doctor and the medicines are not there, that's why we focus on the patient and give them the right medicines for rational medicine use. It's also stated that the paramount importance of pharmaceutical care, cognitive services, and proper role of pharmacists in disease management cannot be overemphasized. Our other healthcare professionals, as well as patients, must believe in us. They must trust us and respect us as pharmacists and pharmaceutical scientists because we're the 7-star pharmacists. Pharmacy education must produce professionals and standards of practice that are deserving of such public trust. This year's World Pharmacist Day was celebrated on 25 September, and the theme was Transforming Global Health. Yes, pharmacovigilance. This theme signifies the role of pharmacists in matters relating to global health. Considering global impact of the COVID-19 pandemic, this is very relevant indeed. The world was brought to its knees by the coronavirus. The World Pharmacist Day theme was an opportunity to communicate how pharmacists are transforming global health through a variety of health services in their communities. Currently, FIP has worked hard to support pharmacy education to try and produce a pharmacist who can do a lot of other activities. Can I please have the next slide? So when the patient comes in, I just picked this one. It was circulated by a colleague during the World Pharmacist Day. I'll just quickly go through the cartoon. We've always said, you are most accessible healthcare professional. And they come in, give me free health advice now. Of course we do it and to empower them. And then we're also a driving force behind discovering new medicines. Even governments, they're on their knees appealing to pharmacists to do research and development. The meds are right here. There you are, research pharmacist. The key that you unlocks all your need to know about your medicines. But the good thing is we are pharmacists and we are not expected to know everything all the time. There's always, we often call him Dr. Google, but we have to be very careful with the sources of our information. So you have to check your references. And these references have to be reliable sources of information. So when we talk to Dr. Google, let's get the right places and the right documents. All right, always, so your pharmacist is always with you in sickness and in health. So where's the pharmacist? When I talk of pharmacists in sickness, when we produce the medicines to treat the various conditions. With the COVID-19, there's been a lot of research on a lot of medicines, and they were looking for the pharmacist to do this so that they bring the correct medicines. And then there's also the vaccines, which are for those in health to ensure that they don't get sick anyway. So there's been a lot of noise about research for the COVID-19 vaccine. So wherever you are, do your best.